I found myself in college pursuing public health as a major and taking sort of a bigger picture view of healthcare in the United States, and became really fascinated with women's health in particular. So when I made it to med school, I kind of thought, oh, maybe I'll do OBGYN because of the intersection of justice and medicine. They're just so intimately linked, and that naturally progressed through residency to finding my way to maternal-fetal medicine. I ended up interviewing here and immediately knowing that this was the right place for me, that the people here were deeply invested in my professional development, but also my personal development. I think the patient population is incredible. I really enjoy getting to take care of a diverse community of people. I really appreciate the broad spectrum of pathology we get to see here. It's relatively small, but spans early career to late career physicians who have differing levels of knowledge, wisdom, interest, and each of those people are uniquely invested in each other. You can tell one of the things that's the most special about the division is people tend to join and stay, which I think speaks to how happy people are here. But it's not just the attending physicians who have been a huge part of supporting me personally, but also the APPs are a really critical part of our everyday function. I think one of the things that's really special about UW's relationship with Meriter is we have a huge clinic staff. So we have a large group of sonographers who are part of my everyday clinic support staff, like nursing and MAs, who are all, it seems trite because I think you'll hear this a lot, but it feels very much like a family. One of the major highlights of our program is the 2 months that you get to spend with our education sonographer, Kelsey. She is employed to teach and takes that role really seriously. From there, you might go to a clinical month where you spend time inpatient, where you really get experience teaching residents, teaching medical students, and acting as an attending for the antepartum service, caring for a busy service that's very acute. We have a lot of patients in the ICU. We take care of a lot of really unique pathology, things that I had never heard of until I started fellowship. You also spend time seeing patients in clinic, which I think is another huge highlight of our program. Every fellow gets their own clinic for a half day a week where they build a roster of patients who they follow for their entire pregnancy. Those patients you really take ownership of. You manage their prenatal care, you make plans for their delivery. You are the one that is responsible for coordinating with all of the consultants and making a delivery plan. We also have lots of clinical volume for procedures like cerclage, CVS, and amniocentesis that are always happening. And so instead of being one person that's committed to doing all the procedures, they're available to all fellows all the time. And when you're free, you just get to go take advantage of them. There are a lot of really passionate researchers within our division and a lot of institutional support, which I underappreciated how important that would be. So I've already been invited into projects from my attendings and mentors, which has been really helpful. But also I came in with the idea of an idea that I wanted to sort of pursue as a fellow, and was immediately connected with so many people who were going to be excited to help walk me through turning an idea of an idea into an idea and then into a project. I hope to work on a project relating to anti-fat bias and weight bias in obstetric care, so that we can improve patient experience and ultimately patient outcomes for people of higher weight who are pursuing pregnancy. One of the things I really appreciate about this program is the commitment to education, including our didactic time that we get every Wednesday. I think it's really special that for just 3 fellows to get to come in and have a lecture by a leader in their field, someone who typically is not an obstetrician, is not a gynecologist, but is someone who we collaborate with, like cardiology or GI, but also who has a special interest in how that intersects with pregnancy, to teach us about their unique pathology and how we can better manage it in pregnancy and collaborate is really special. We also have community and industry leaders come talk to us, in addition to getting an hour to spend working on the SMFM Fellow Lecture Series as well. So getting 2 protected hours a week for education, I think, is really unique on top of all the other educational opportunities that are built into our curriculum. We also get time for simulation, and then, of course, time going to our department-wide didactic time. Professionally, I think this program prepares you for any job you want to take as a next step, whether, that be like my co-fellow Scott, who's actually pursuing more training and fellowship to become a fetal surgeon, to my other co-fellow Jackie, who wants to be like a bread and butter MFM, but doesn't give herself enough credit because she definitely has a research interest and an incredible research profile, to someone like me who's still a little undifferentiated but also hopes to be able to pursue whatever ultimately strikes my fancy. This program is really supportive of a diverse host of interests, but also can provide those opportunities. One thing that was really important to me when looking at a fellowship was a program that, even if they didn't have the infrastructure that already existed, was a program that could support ongoing family planning training. I really wanted to maintain the skills that I had learned in residency, and this program has been really supportive of that. Additionally, I wanted additional time and training spent in public policy and justice initiatives, which this program supports, so that I could be involved in ACOG or SMFM in the future. But ultimately, I think the thing our program does best is provide a really strong clinical foundation for ultrasound, inpatient, and outpatient care that you can take into any job. My husband and I sort of joke it's been a little bit like living in a fairy tale. We can walk to the lake, we can walk to the local ice cream shop, we can walk to the grocery store, we can take our dogs anywhere we want. There are too many things to do that you have to triage what strikes your interest that weekend. And we're lucky that we don't take too much call, so you really do have a lot of weekends to yourself, and even when you're on call, you are at home. So as long as you're not called in or rounding, you can still enjoy all that Madison has to offer. Some of our favorite things are the farmers market, which I'm sure you've heard about, but also we love just getting to explore our neighborhood. There's almost always a festival in the summer of some kind. Lots of neighboring small towns that have infinite charm, and then the natural beauty of Wisconsin that is maybe underappreciated by the rest of the country. I knew from the moment I interviewed that this was the right program for me, and I hope that for our future fellows, that's the experience they have as well. As an individual, you are wholly celebrated in our division for your professional and academic interests, but also for who you are as a human outside of work. I think people who are lucky enough to train here leave a better person, a better doctor, because of the people they got to surround themselves with for 3 years, and the opportunities that are prioritized by the division and our program, like giving you money to do your research so that you don't have to worry about how you're going to make it happen, giving you infinite mentorship from a small division that knows you so deeply well, and then getting to take care of patients from all over Wisconsin who are so eternally appreciative for your care.